Look great, right? But an underlying situation could be causing a problem. Dr. Zoe Deol from the Center for Vein Restoration is here with patient Julie Adams and ultrasound tech Heather Miller with how the center can help. Good morning, ladies. Thanks for being here. We're going to show you what's going on in our legs, right?
Absolutely.
So there are some actual diseases that we can have. Talk a little bit about what we can be dealing with.
So venous insufficiency, which causes varicose veins, sometimes is pretty obvious when you see bulging veins on the legs, but sometimes it's not so obvious.
Sure.
If you take a look at Julie's legs here, they're quite beautiful.
They are!
Thank you.
Julie.
Yeah, and Julie recently had a baby, and
congratulations.
Thank you.
It's a lot of work too.
Oh yeah.
It is. And what did you notice in your legs after the baby?
When I would step and walk, it would be built up pressure. It just felt like it was gonna explode almost.
Yeah, we don't want that.
Yeah.
Right. You can help.
Exactly. So what we did was an ultrasound scan of Julie's legs, which I'm going to move over here.
I'm going to move away here so you can see too. What are we looking at here?
So we're looking at this circle is a vein inside the leg.
Okay.
Like you're looking down a garden hose. Now Heather just turned her scan sideways, so this is like you cut the garden hose in half. So we look at color to see which way the blood is flowing. It should be blue if it's flowing up towards the heart.
Okay.
And when you have venous insufficiency, when you stand up, the leaking valves inside the vein causes the blood to go down, and you'll see red.
Red.
So
I think we saw a little bit of that there.
Yeah.
Yes.
She's going to squeeze her leg now, and you'll see blue initially, and then red.
Yes.
The red is the blood flowing back down through a leaking valve. So basically, Julie, when she stands up, the blood, when she takes a step, will go up, but then most of it is coming back down.
Okay.
So what that does is causes pressure on the branches in her leg, and you can see a bulging varicose vein coming out of her leg there. Now, most people might write that off as just, I'm getting older, aches
Yep, it
and
happens.
pains.
I just stand a lot or whatever.
Yeah.
But you can help people feel, we don't want to feel like our leg is going to burst, right? We don't want to feel
exactly.
that. So what can you do?
So after we do a painless ultrasound like this, we do an office procedure. She doesn't need to take any time off of work or mommy. And she just comes in the office, and I seal down the vein that's causing the problem and put a little Band-Aid on and send her on her way.
Have you done this before? You've done this? Not yet. So you're ready to go.
I'm ready.
Yeah.
And when you first went in to see the doctor here, what were your expectations?
Just some relief. Be able to walk and chase my kids and keep up with day-to-day life with my leg not hurting.
Right. So what are you looking forward to now?
Being able to run at the gym, walk with my kids, take them on bike rides, and my leg not start to have that pressure feeling.
Right. Is this a kind of a one-time procedure, or is this something that you need to maintain?
So it is a chronic condition. That's a great question. So Julie's really young, and this is early for her.
Sure.
So untreated, down the road, she could develop venous stasis ulcers where the skin opens up. So what we're going to treat are the veins that are bad in her legs today, but down the road she can develop other veins that go bad. So yes, it is a chronic condition, and it runs in families. So if you have family members that have this disease, and you're on the younger side and just had a trigger such as pregnancy or jobs that you're on your feet, and you feel those aches and pains and heaviness and pressure, even if you don't see those signs on your legs, it may not be just, I'm getting older.
Right.
It could be insufficiency. And like I said, it doesn't look like she has bad disease, but both legs, both sides, all the way top to bottom, she has bad.
You can see that red.
Yes.
Yeah, it comes through. So when you're doing the ultrasounds, this pretty typical thing that you come across?
It is very typical, yes.
Yeah.
It's different in every person, but for the majority of the people we see, it's about the same.
You're good. So if somebody is interested, they want to come in and schedule an appointment, is it a situation where you come in for maybe a consultation first, kind of talk with you a little bit, or what can people expect when they come in?
So when they come in for an appointment, you don't need a referral. That's a big question patients ask. Do I need to have my doctor send me? No, you can come right into me, and what we do is do a little interview first to see if we even need to do this. Because sometimes it is not a suspicion for vein disease. So we'll do a little interview. If it sounds like it's a possibility, we'll do an ultrasound scan. I'll lay out the treatment options, and then we go on our way.
And as you said, you don't even need to take time off of work or mommy, right? And that's a full-time job too. And you could just kind of be in and out and feeling a lot better, right?
Absolutely. They can just give me a call at on the website. www.centerforvein.com. I have an office in Southgate, Michigan, and another office in Oregon, Ohio.
Very good. So right here local, maybe you're in Michigan, maybe you're here in the Toledo area, you can come on in.